Dr. Sib. I'm with Barbara here, and we get a lot of questions from my website. So I'm going to ask Barbara to kick off with the first question.
Okay, Dr. Sibthorpe. Our first question is from Lizzie, who's 36 years old. My face has changed in the last few years. It used to be more heart-shaped. I'm not sure if it's age or grinding my teeth or migrating filler, but I need help. I'm not sure how to change my face shape to be more heart-shaped or oval. Do I add filler to my chin? Do I get Botox or filler on my jaw? She sent a picture. So maybe you could take a look and see if...
Okay, well, that's a good question. It's something I get asked a lot as an inquiry. Now I'm looking at this picture here. It's a good idea, by the way, to send pictures in because it gives me a much better idea of what the problems are. And one of the first things I can see from here, in my opinion, is that she's had quite a bit of filler into the cheek area. And so not sure necessarily about this being a heart-shaped problem or not, but as you do get older, you do tend to get a squarer face in the ladies. You typically start with an oval or triangular shape, but with age and gravity, soft tissue descends and it becomes more square-shaped. And we normally would start by using mid-face volumization and lift. And most of the time it's about lift. It's never really about volume. It's really about lifting the tissues that have become sagged. And I think one of the problems I'm seeing here is that I think the patient has had too much filler into this area here, probably more central. One of the things, if you are mentioned, I think, was teeth grinding can square out the face as well, particularly where these muscles, these masseter muscles, become stronger and bigger. And so, yes, we can use Botox to shrink those. If we're looking to change the shape of the face, that's part of the treatment. The other part would be using fillers here to increase this length between the zygomatic arches. But I think, as I said already, really, the age of 36 as well, we want to be looking at lifting, not necessarily changing the shape too much, and not putting too much filler in. There's a topic that we'll discuss later. I've coined the phrase called chicken wings, and it's where I see patients having too much filler just in this area, in the mid-face, without balancing or paying attention to the upper or the lower part of the face. I hope that answers the question.
I hope so too, but it's something to think about.
Mm-hmm.
Okay. Our next question is from Renee. Which treatment options would be best for targeting dimpled and loose chin skin?
So chin, dimpling around here and chin skin and a loose skin here. Did the person give an age by any chance?
Renee is 54 years old.
Okay. So there's a couple of ways to look at treatment in this area. We tend to get a lot of cobbling of the chin from muscle activity. So you can actually use Botox in the chin to prevent some of that cobbling. But the skin around the mouth and particularly around the chin area can become quite crepey and quite lax. And so this is where we use skin boosters, and they are looking to really hydrate the skin around that area. So we're looking to use very light fillers, and we tend to call these skin boosters. They're not so much about volume, it's about hydration. So that's a good way to treat those. There are some new treatments coming out online, and one might be looking, say, at polynucleotides perhaps in the future.
Okay, thank you. Our next question is from Beth. She's 44 years old and took Ozempic and lost 20 pounds. She's in better health and at her ideal weight. However, she lost volume in her face. Any advice?
And again, that's another common question I see a lot as well with patients now using this Ozempic on a much it's more commonly used. And typically you're losing fat in the face. So you're losing not just superficial fat, but you're losing deep fat. So it tends to give you a very gaunt look. So if you're going to address that issue, you're going to be looking to use fillers in much of the deep plane as much as the superficial plane, really to add back volume against necessarily just lifting. And also in the subcutaneous planes, the superficial planes, where we've lost fat as well, we do now use products such as Harmonica that will stimulate some collagen production and fat production, particularly where you've got some laxity of skin, particularly around this area here. And there are other products that we're using, such as the Profilo range and the Structura range, which is again addressing some of this laxity in the skin.
That's it. No
That's
more
it.
questions.
No more questions. Well, until next time, please keep sending them in. They're getting more interesting, the questions, and please send some photographs in. That's very useful too. Thank you.